the latest developments in the fight against COVID, we have Dr. Shikha Jain. She's the assistant professor of medicine at the University of Illinois. Welcome back, doctor. It's a pleasure to have you. So as Dre, our reporter, just mentioned in his package, New York is once again the epicenter of the virus, with the Omicron variant spreading quickly there. In your opinion, will it get worse before it gets better, because it's feeling like deja vu all over again?
Thanks for having me back. And you're right, it is feeling like deja vu all over again. We're seeing numbers go up across the country. We're seeing hospitals overwhelmed. We're seeing healthcare workers burning out and getting sick. We're seeing staffing issues. The big difference from last time we went through something like this a year ago, we now have vaccines. So we have ways to protect ourselves and protect our loved ones. The other really big difference between then and now is now our hospitals are filled with COVID patients, but they're also filled with people who are sick with non-COVID illnesses. We saw a drop in hospitalizations for other medical problems at the beginning of this pandemic. We are now seeing people who are sick with COVID and also without COVID, with other medical problems. So our hospitals are overwhelmed. Our healthcare workers are burned out. The numbers are going up. We are in the middle of the holiday season, and we're already in a surge as we're about to enter the Christmas holidays, when we know a lot of people are traveling and socializing. And those risk mitigations that were in place a year ago, in many places, they are no longer in place, or they are significantly modified. So we're kind of heading into the perfect storm of trouble as we enter this next phase of the pandemic.
Yeah, absolutely. According to a Boston Globe article, a recent South African study shows people who were infected with COVID being reinfected with Omicron is high. How does this impact natural immunity, and how does this ultimately change the game now, based on what we know?
So this supports what we've been saying ever since the vaccines came out. We know that the vaccines are more effective and they last longer than the natural immunity that people are touting if they've had COVID before. So even if you've had COVID, you still need to get vaccinated for a variety of reasons. When you got COVID, it is very possible the variant you were infected with is not a variant that is currently circulating. So it's more likely that you would be able to get COVID again. We're seeing that play out in South Africa, as you mentioned. So even if you've had COVID before, I want to really stress you really need to get fully vaccinated and boosted as soon as possible, because that can protect you way more than the potential for having any antibodies left over from when you were originally infected.
Yeah, Dr. Jain, senators, I'm sure you've heard by now, Senators Cory Booker and Elizabeth Warren both testing positive despite being fully vaccinated and having that third shot. Both say they are experiencing mild symptoms. Should vaccinated people be concerned at this point?
I think if you're a vaccinated individual, you can be way less concerned than people who are not vaccinated, in the sense that if you do contract COVID, it is unlikely that you will be admitted to the hospital or get very ill. If you get COVID and you're fully vaccinated and boosted, you likely will have more mild symptoms. What vaccinated people should still be doing, because we don't want you to get COVID if you can prevent it, you should be wearing masks when you're indoors. You should be wearing masks anytime you're socializing with individuals who don't live with you in your household. You should still be trying to social distance. If you're getting together for the holidays, make sure you've got great ventilation, and everybody should be tested before they get together. And you need to make sure everybody who's attending is vaccinated. That being said, I have children who are too young to get the vaccine. So that's why it's also important to add those added layers of protection by getting tested the day of seeing people and also wearing masks indoors.
Yeah, ultimately boiling down to not being selfish. Dr. Jain, let's talk about T-cell immunity and how that could also be leading to these breakthrough cases, those folks experiencing mild symptoms.
So, when we talk about T cells and B cells, there's a lot of immunology education that's happening on TV these days, which I
Yes.
love. But when you talk about different types of immune cells, there's some immune cells that the immunity lasts for a long time. So, for example, memory cells. But then there's other cells that have a shorter level of immunity that only lasts for a short amount of time. So you have to remember the T cells and the B cells, the memory cells, they're all working together to help protect you and to help your body remember the virus and then the vaccine, and protect you from hopefully recognizing it again if you see it, and then protecting yourself. Now, the challenge that happens is some of this immunity doesn't last as long, which is where the concept of the T cells and the B cells and the long lasting immunity with memory cells comes into play.
All right, Dr. Jain, thank you so much for joining us. Very insightful conversation. We just have to hope for the best at this point.